So morning, Ashley.
Good morning.
Yeah, so how long has your practice been established?
It opened 14 years ago. It used to be a sweet shop before we opened it. So we opened with no patients and thankfully we got busy quite quickly.
A sweet shop, that's a bit ironic, isn't it?
It is a bit, isn't it?
Yeah. So whereabouts is it located?
It's in a little village called Balsall Common, which is central to the West Midlands. It's 20 minutes drive from Birmingham and Coventry, about 10 minutes from Solihull and Kenilworth, 10 minutes from all the local motorways.
So it's really easy to get to. How about parking?
Parking is very easy. We've got plenty of parking on site.
Why do your patients keep coming back to your practice?
I think it's because they found what they were looking for. So a lot of the time people have visited a number of dentists and not been entirely happy with some aspects of the care they received. They're looking for a solution to their individual problem. It might be that they're not happy with their smile, they wish their teeth were straighter, they wish things were more reliable, lasted longer. The solution might be implants, it might be adult orthodontics, it might be simple advice on options that are available to them. And I like to help people to understand what their options are, more importantly what their options aren't, what I think will work well for them, what I think probably won't work well, what the advantages and the disadvantages are, and the costs and the benefits and the risks, and let them make their own decision.
You have a big emphasis on hygienists in your practice, don't you?
We've got 4 different hygienists that work at the practice on different days, and without fail all of our patients speak very highly of our hygienists.
How easy is it to get an appointment that suits my busy agenda if I'm, say, working in London?
I have a lot of people that are living near the practice and working some distance away in roles that are difficult for them to take time off work. For that reason, we offer appointments on Saturdays, we offer appointments late on Monday evenings. We're able to accommodate most people's needs.
And if I wanted to make an appointment at your practice, I mean, could I make an appointment to see you?
Absolutely.
So that's not, I don't have to see somebody else. I could actually see you if I wanted to.
Absolutely. I have another dentist, Dr. Kathy Myatt, that works with me. She's my dentist. She looks after my teeth. She's excellent. She's got a special interest in facial cosmetics, so she likes to help people to smooth their forehead out and get rid of the lines around their eyes. But we're happy for any of our patients to choose to see whoever they want to see. I think a degree of anxiety is normal. So I think everybody's worried that their anxiety isn't normal, and I think to a large degree it is. But I think for many people we can help them. And for many people their anxiety relates back to something that didn't go well for them in the past, often as a child. Often it relates to not feeling that they're in control. And often when we're able to explain to people what their options are and they're choosing their own path forwards, often the anxiety starts to disappear. So, some people need more help than that. So some people, we need to help them by prescribing a medicine that they can take, or we have something called gas and air, which is a bit like ladies have when they have a baby, and a lot of people find that very helpful.
So, Ashley, I suppose the other big fear that people have of going to the dentist is the cost of going to the dentist. And I know your prices are clearly published on your website page and all that kind of thing, but it must happen sometimes where people are confronted with a cost that they have some difficulty to fund. How do you cope? How do you deal with that?
There's no surprises for patients at our practice regarding cost. We always give people a written quotation that lets them know exactly what they can expect. Before we even produce a written quotation, we've had a discussion about cost, about options, and people will make their decisions based on which option they feel suits their situation best. People have a number of different financial choices. They can choose to spread the cost out over a period of time. We're able to arrange interest-free credits. We're able to stage treatment so that it fits within people's financial situation. We're able to offer a discount if people choose to pay in advance. It's really up to the individual.
Right. Okay, thank you. Actually, one last question, and it might be a little unfair, but I'm going to ask it anyway. If you weren't a dentist, what would you be?
Oh, I couldn't be anything else.